Hi guys, it's Tamara coming back at you with another video. Welcome back to my channel. We're going to go ahead and just get started and start talking about traumatic stress. I want to talk about acute traumatic stress and chronic traumatic stress. This is a very important topic, and this is something that a lot of my clients are struggling with. I'm seeing clients in two different practices. So this is my personal practice, my independent practice, and then I also am a part of a group practice. And in that particular location with the group, I'm finding that a lot of the adults that I'm working with, they're struggling with acute and chronic traumatic stress. One of the issues that they're having is trying to differentiate between chronic and acute traumatic stress and PTSD, post-traumatic stress disorder. So I figured that I would, just for the purposes of our discussion on trauma that we're going to be doing over the next 4 weeks, I figured I would just describe and define what acute and chronic traumatic stress is. Now, next video, which is coming up here on, I'm trying to think when the next video is going to come. It's coming up on Monday. So we're going to focus on complex trauma and post-traumatic stress disorder. And then next Friday, we're also going to talk about vicarious trauma, and I want to give some examples and some stories to kind of help you go along. Each video is going to be 10 minutes, so let's go ahead and get started. Okay, the benefits for you today in this video is that you're going to be able to define acute and chronic traumatic stress. So let's jump in, all right? So when we think in terms of acute and chronic traumatic stress, we have to look at symptoms, okay? Or we have to look at the expression of emotions, thoughts, and physiological reactions. So I'm gonna put the definition over here for you. When we're thinking in terms of acute traumatic stress, we're thinking of physiological reactions that are happening because of what we call the sympathetic nervous system. So I'm going to start like posting some definitions around so that you guys can follow me and kind of keep up with what I'm talking about. All right, guys. So over here, I'm going to put acute traumatic stress just to give you a definition. And over here, I'm going to put chronic traumatic stress. Okay, and then we're going to talk about what's called the autonomic nervous system. The autonomic nervous system. What comes to mind when you hear autonomic, right? Automatic, okay? Autonomic nervous system is the nervous system in our body. It consists of the brain and the spinal cord, and it has a lot to do with all of our autonomic processes, right? Our breathing, our blood flow, our endorphins, a lot of emotions, a lot of brain chemicals, right? All that stuff is autonomic or automatic in our body. So we have the autonomic nervous system at the top, all right? So let's kind of conceptualize this as an umbrella. And then under the umbrella is the sympathetic nervous system and the parasympathetic nervous system. These two systems often work in tandem, right? They work together, right? So the sympathetic nervous system, I want you to conceptualize that as the gas pedal, okay? The gas pedal in our body, right? Once the gas pedal is pressed in the sympathetic nervous system, you're going to get increased heart rate, hot flashes, sweating, sometimes nervousness, anxiety, shaking. Some people lose their ability to urinate, right? So their kidneys and their urine kind of contracts, right? Your blood vessels constrict. Your pupils restrict, right? So the body, when it's being revved up, again, to conceptualize that gas pedal, then we're talking about a system that is often triggered by environmental stimuli, right? So let's say, for example, your acute and chronic traumatic stress is being triggered by the fact that you're driving by a car accident and it triggers a memory of when you had a fatal car accident. Your sympathetic nervous system may start to rev up just because you're seeing somebody on the road dealing with the same situation that was traumatic for you that you once dealt with. Your sympathetic nervous system, imagine that gas pedal being pressed, right? That sympathetic nervous system is starting to rev up, right? Your heart rate may go up. You may start to have hot flashes. You may start to have flashbacks. You may start to shake. You may start to sweat, right? So keep that in mind. Sympathetic nervous system. Over here, we have the parasympathetic nervous system. Consider this part of our nervous system as being the brake pedal, right? it stops everything. It halts everything that the sympathetic nervous system is doing. So the parasympathetic nervous system results in decreased heart rate, right? Shaking stops, nervousness stops, right? Your heart rate is at a normal pace. Goodness, if I can speak. And then also your sweating is reduced. Your thoughts may stop racing, right? You may start to feel less warm, right? You're cooling down, your body temperature is coming down. That's the parasympathetic nervous system. These two systems work together when we are talking about acute and chronic traumatic stress. It's often triggered, okay? The gas pedal, like revving up engine part of our autonomic nervous system is revved up by triggers. And then when we relax and we use coping skills and we go to therapy and we take care of ourselves and we do everything that we need to do to stay healthy, then the brake system, which is the parasympathetic nervous system, kicks in. And that's what we want, all right? So let's go ahead and kind of define one more time and briefly, so we can make this a 10-minute video, acute and chronic traumatic stress, okay? Acute traumatic stress, I'm going to put the definition over here, and then chronic traumatic stress, I'm going to put the definition over here for you as well. Traumatic stress can be long-term, which is chronic, or it can be short-term, which is acute. Either way you look at it, you're going to experience sleep difficulties, eating difficulties, right? Eating too much or not enough, back to sleep difficulties, maybe too much sleep or not enough. You're going to also probably experience increased anxiety, hypervigilance, right? Increased startle response, or an extreme startle response, meaning that, you know, you're easily startled, right? It's like that, oh my God moment, right? And some other things like depression might happen. You might actually have a little bit of flashbacks of the event, but once you start getting too far over into flashbacks, then we're kind of teetering over towards post-traumatic stress disorder, and we'll talk about that in the next videos. But just for the purposes of this video, you want to keep in mind how the autonomic nervous system works in tandem with the sympathetic, I'm sorry, this is the sympathetic and the parasympathetic nervous system. And you also want to keep in mind that with acute and chronic traumatic stress, that's the system that's in power. Okay, guys? So I'm going to come back and explain this to you just a little bit further. Post your questions or your reactions to this video in the comments section below. I look forward to answering them. I'm getting a lot of emails, which is really awesome. Like, I looked yesterday and there was like 50 emails about my last video. If you haven't seen that, I'm going to post it in the comments section below. But I encourage you to send me some questions regarding this video as well if you need clarification or you want to ask me something about this. But in the meantime, guys, I wish you well. I'll see you really soon with the next video. Bye-bye. Okay, well, I'm traumatized for a short period of time and I'll get over it. Or is it I'm traumatized for a long duration of time and I'm never going to get over it, right? So a lot of people who think of, I'm going to start with acute traumatic stress, when they think of that, they think, okay, well, my mind and my body are going through a period of adjustment and it's going to be short term, right? Part of that is true. Acute traumatic stress is basically a host or a variety of symptoms that hits you